Well, I'm a native Houstonian. That makes me a native Texan. My first job in the design world was as a delivery boy at a firm in Houston called Baxter & Courage. And I got that job because I won a contest while going to school at the University of Houston. In the early 90s, I wanted to do something different. Became a partner in Pentagram, the international design consultancy, moved to San Francisco and was there for 3 years. Decided to move back to Texas. My name is Lowell Williams and I run Lowell Williams Design. I got involved with Planet Cancer around 2006, 2007. My son, Jeff, actually introduced me to Heidi, the founder. He and I actually designed the identity together, which was great fun. And we started designing their communications using a tone of voice for editorial that they had already established.
When I met Lowell, it was originally to work on rebranding Planet Cancer and creating a new identity, a new logo. And so we had lots of spirited conversations about design and what that logo should look like and how it could represent Planet Cancer. I was diagnosed with cancer when I was 26 years old. And I went through my whole experience without really seeing anybody else my own age in the hospital, in the doctor's office. So really I started Planet Cancer as a way for other young adults to find each other and have someone else to support them through that experience who understood because they had been there too. Since Planet Cancer has come on board here at LIVESTRONG, we've gained a much bigger platform.
A former employee, Megan Weber, is actually the catalyst for making it possible for me to actually do this project that got the grant. The purpose is to communicate to the medical profession how it is to be in the age of 20 to 40 and have cancer, and where the research industry and where the medical industry has all but forgotten them.
This project was what we ended up calling the Advocate, which was a tool that would empower a young adult patient to have a conversation with a healthcare professional, a doctor, a nurse, a social worker, and to educate them about the needs and issues of a young person through the lens of their own story.
Without this literature, without the help and the support of Planet Cancer, they may not know how to talk to a doctor about insurance. They may not know how to talk to a doctor about sex. They may not know how to talk to a doctor about anything. And it takes a special person to actually stand up to a doc that's busy and say, hey, wait, you got to pay attention. This is really important.
I think that good design is always going to be a part of any initiative that wants to have impact. I think because that's how you get the message across. That's how you frame the message. That's how you get it across. That's how you make people respond on an emotional level.
Any project having to do with health, having to do specifically with cancer, certainly gets my attention. I'm a cancer survivor, so I consider it pretty much an honor to be here after 17 years in the first place. So it's not only my responsibility to give back, it's my responsibility to maybe help somebody where I didn't get help. I think this idea that SAPI has about recognizing design associated with socially responsible projects is quite phenomenal. I don't know that that exists anywhere else in the world.